hope, and courage. A tribute to breast health on ABC 27 is presented by Penn State Milton S. Hershey Medical Center.
Welcome back. Dr. Susan Shetter is here to answer some more viewer questions for us. Here's the question. If you have a mastectomy, do you also need to have chemotherapy or radiation treatments?
Generally, after a mastectomy, radiation therapy is not indicated, but there are always exceptions. As far as chemotherapy goes, all tumors are different, and really the DNA of each tumor may require a different type of chemotherapy, so it really depends on looking at the tumor and treating the individual as an individual.
Okay, and we have time for one last question. I'm only 28, but concerned because my mother and grandmother had breast cancer. Since there is family history, should I get a mammogram before age 40?
Very important question. We recommend that women get a mammogram 10 years before the index cancer. What that means is that if your mother was at age 40 when she had her breast cancer, you should start getting annual mammograms at age 30. So it's 10 years before the index cancer, but not prior to the age of 25.
Okay, Dr. Susan Shetter, thanks for joining us. And we want to thank all of the specialists here tonight. You can see they're busy answering the phones. The lines will be open until 8 o'clock, or you can email your questions to questions@abc27.com. Back to you, Chuck.
Thanks again, Brenda, and Deborah, and a good job in there. Now we're joined, you saw her earlier in the package, the co-director of the Breast Center, Dr. Rena Cass. Doctor, how is this approach to breast cancer different at a university hospital such as Penn State Hershey Med Center? How's that different?
Well, I'll tell you, Chuck, it's different because at a university center, you have a multidisciplinary approach to breast cancer. So that means the entire breast team, the breast radiologists, the breast surgeons, the oncologist, the pathologists all get together weekly and discuss all the new cases to make sure that everyone's on the same page. But really, the true difference at a university hospital is that this entire team works side by side with the researchers working together for a cure for breast cancer and a prevention for breast cancer.
Now, there's always advances, just from the time we talked in between shows. Talk about some new advances being made.
Well, I think one of the most pivotal changes that has happened over this past year is our approach to how we take care of the nodes underneath the arm to see if cancer has spread to the nodes. It used to be, up until about 6-7 months ago, that if someone had cancer that spread to a few nodes, we'd have to take a lot of nodes out, and that would leave the patient with perhaps some morbidity and some swelling of the arm. But just within this past half a year, there's been a dramatic change in our approach. There's a pivotal study that was released called the Z11, and in that study it showed that women that were having breast-conserving therapy, meaning a lumpectomy and radiation, if they just had a few nodes positive, they didn't really benefit from having a whole bunch of nodes removed. And that is wonderful for those patients, that we could limit the amount of surgery.
That's a big change there. And well, tell us about the research taking place at the medical center, because there's exciting news there too.
Yeah, lots of members of our team are engaged in really terrific and exciting things. Dr. Lipton is working on bone research to try to prevent metastases to the bone from breast cancer. Dr. Shetter and Dr. Manny are working on preventing breast cancer by decreasing the breast density. And really, one of the most exciting things that's just been talked about this past week is Dr. Craig Meyer's research using a virus that appears to selectively target breast cancer cells. You know, the great thing about being at the breast center is just this morning I operated, came out of the operating room, went up to the 6th floor, went to Dr. Meyer's office, and we talked about how can we at the breast center help him help our patients.
He's right down the hall.
And he's right down the hall, and it doesn't happen anywhere else.
Well, doctor, they talk about clinical trials. How important are those?
You know, clinical trials are really important. Brenda Stauffer was on a clinical trial. And what the clinical trial does for the patient is it allows them to have standard of care and also to have a novel agent that might help them against the fight in breast cancer. For their family and their friends and future generations, it offers us a hope of that we might be treating breast cancer in a better way down the road.
That's something that the patient wants to bring up to you when they come in there.
You know what, if we didn't have clinical trials, and everyone would be having a Halsted radical mastectomy and having muscles removed and their entire breast removed, and that's really unnecessary, and we owe all the patients in the past that have had clinical trials
Lots of progress.
Yes.
Thank you, doctor, for joining us tonight. We also want to thank you, the viewers, for sharing your stories and sending in your questions. If you'd like more information or you'd like to schedule your mammogram at the Penn State Hershey Breast Center, call 1-800-243 1455 or visit online at pennstatehershey.org/breast. Thanks for watching.